All right, welcome back, everybody. We are now going to look into chronic pain. Now, from the lecture before, we talked a little bit about what's happening in the addiction cycle, specifically when it comes to opioid use. And, pain is a very sensitive subject. In fact, pain is a huge contributor to depression, anxiety, as well as PTSD and trauma. Typically, patients who have chronic pain, this is pain anywhere longer than 3 months that they've been experiencing, will typically do well with a combination of mental health therapy, perhaps medication, potentially surgery, but also even different things like massage therapy, acupuncture, chiropractic care. It's really a comprehensive approach to dealing with pain, and it's usually associated with some type of physical damage to the body. Now, usually the body can heal itself after a certain period of time, but there's a percentage of people in the population that even after 2 months, 3 months, 6 months, 6 years, they still are experiencing pain. Pain is perceived by a special sensory nerve cell called a nociceptor or a pain receptor. These are receptors that are specifically made to detect pain, is that it's detected by these afferent or sensory neurons. It goes through the dorsal or the posterior horn of the spinal cord, which then triggers a number of excitatory or inhibitory neurotransmitters, right? These chemical messengers will transmit through the somatosensory cortex, which is a part of the brain that is responsible for processing some of those physical sensations. So I know I said a lot of words just then and there, but the important thing to remember is that those nociceptors, those pain receptors in your hand or in your fingertips, whenever it experiences pain, it's going to detect that signal through the spinal cord and up to the brain. It's going to get to the thalamus. The thalamus is going to relay that signal to different areas of the brain. And then therefore the brain is going to perceive it as pain, right? And that's why when we talk about pain treatment, cognitive behavioral therapy can actually be very useful, because what's happening is that a lot of times the experience of pain in the brain is hijacking the prefrontal cortex. The person is exacerbating the pain, is either feeling depressed or anxious because of the pain. And so typically cognitive behavioral therapy is used to reduce those levels of depression, anxiety. And typically when depression, anxiety goes down, the person will naturally therefore experience a little less pain. Now, it may not completely solve their pain issue, but it will reduce that level of pain. Even if it's from like an 8 to like a 6, that's still a huge improvement in pain reduction. All right, so let's go a little bit deeper and a little bit further into the acute pain pathway and kind of see a little bit of what is going on. So let's say you have a signal, you have a painful stimuli. It goes from, let's say, your fingertips. The afferent sensory neuron is going to detect that painful stimuli. It's going to go up to your spinal cord and up to the brain. Your thalamus is going to receive that signal, kind of replay that signal to the other areas of the brain. From a neuron perspective, what's going to happen is that glutamate, the excitatory neuron, is going to be released. It's going to bind to these NMDA and AMPA receptors. These receptors are then going to have sodium go out of the cell and potassium come in. And in doing that, something called magnesium is going to block the NMDA channels and then allow calcium to enter the neuron from this space. When calcium goes into the neuron, we have a amplified and prolonged experience of that person therefore experiencing pain. So again, sodium flows from that space into the neuron, potassium flows out in the opposite direction, and then magnesium binds to the AMPA receptors, which allows calcium to also flow into the cell from the extracellular space, causing a cascade of reactions that produces amplified pain for that individual. So when you talk about medications, medications might work on certain pathways, surgery might be helpful, but even something like massage, chiropractic care, and cognitive behavioral therapy are all going to be aspects to help alleviate pain for that individual. It's going to be a multi-layer, multi-dimensional team approach to helping that patient deal with pain. All right, so that ends our lecture there. I will see you all in the next lecture.